So before you walk into the room, you wanna check physician's orders, you wanna wash your hands, gather equipment. In this case, we're gonna do an MDI, and then we'll also grab a spacer to go with it. You'll want to make sure you have the correct dosage, the correct medication, make sure you check for expiration dates. So before you walk into the room, you wanna wash your hands, wear the correct PPE. You'll go in, introduce yourself, verify it's the correct patient. You'll let them know that what you're doing, that we're gonna instruct you how to do MDI. You'll want to assess the patient first, check vital signs, breath sounds, SpO2 before starting. You'll make sure that the patient's able to follow directions and is able to use the device. If you're gonna do an MDI, then you'll want to make sure their respiratory rate is less than 25. If it's a DPI, you'll want to make sure their inspiratory flow is greater than 60 liters per minute. Once we establish that they're able to use this device correctly, you'll take the cap off the MDI and then make sure there's no foreign objects around it or in the mouthpiece. If it's been longer than 24 hours, you want to shake it and then prime it into the air. Once you're done with that, you'll place the chamber onto the device. You instruct the patient, you'll have them more like in sitting up position. Instruct the patient to exhale normally and then do a slow inspiratory inhale while you actuate the device. Once they inhale, you have them do a maximal inhalation of inspiratory inhalation of 5 to 10 seconds if possible. If there's more than one puff, then you want to wait a minute or two between puffs. If you hear a whistling sound within the chamber, you'll just encourage the patient to take slower breaths next time. Throughout the procedure, you'll want to monitor their vital signs and SpO2. You'll reassess the patient for effectiveness of treatment. In asthmatic patients, you want to make sure that you check the peak flows. Once you reassess the patient, you'll encourage the patient to cough, take a note of any sputum production. If it was a steroid, you'll want to make sure that they rinse their mouth out. You'll make sure after that, you'll want to make sure the patient is comfortable in a safe position. You'll want to recap the device and then make sure you instruct the patient to clean the mouthpiece and the chamber at least once daily with warm water. You'll take a note of the remaining content of the inside the MDI. You make sure that the patient, also if they're on a vent, make sure that you actuate, time it according to the inspiratory phase in the ventilator cycle. But once you're done, you'll want to make sure the patient is comfortable and a safe position. You'll get rid of any excessive stuff that you brought in. Wash your hands, wash your hands, charged, let any personnel know.